Hey guys, welcome to another episode of Doc Talk. My name is Dr. Michael Bracchio from Velocity Sports Rehab, and in this episode we're going to go over Iliotibial Band Syndrome. Iliotibial Band Syndrome is one of the most common causes for pain on the outside of the knee. People who experience Iliotibial Band Syndrome will describe the pain as either sharp or burning right on the outside of the knee, and it's typically worse with either running or going downhill. Two of the most common causes of Iliotibial Band Syndrome are increasing your mileage too quickly or incorporating hill running too quickly. Both of these situations can cause an overloading of the tissues on the outside of the leg, which can lead to irritation and pain. As a general rule, you don't want to increase your mileage by more than 10% in a given week. This will allow your body to adapt to the stresses that you're placing on it. There are a couple biomechanical changes that you can do to either decrease the pain or to prevent Iliotibial Band Syndrome. One way you can do this is by increasing your step rate by between 5 and 10%. This has been shown to decrease the load on the knee by between 20 and 34%. While it seems that increasing your step rate would increase your risk of a repetitive use injury, it actually seems that the magnitude per step seems to be more important than how many steps you're taking. Another option is to increase the distance between your feet while you're running, which is also called your step width. If you run with a narrow stance, you'll increase the load on the glutes and also on the outside of the thigh. This will increase the strain that you're placing on the iliotibial band because those muscles are having to work harder to control the motion of the leg. When you're looking at treatment of iliotibial band syndrome, you have a couple options. One treatment option is to look at the joint mechanics to make sure you have adequate range of motion in all the joints needed for running, such as the hip and the ankle. Another treatment option is soft tissue therapy, which can either be done by hand or by a metal tool. Typically, the target areas are the glutes and the quads to help desensitize the tissue so that we can load it properly without pain. Generally, soft tissue therapy on the actual iliotibial band itself isn't very effective because the tissue is so dense that it's very hard to stretch. This is also why we don't recommend stretching the iliotibial band or doing foam rolling right on the iliotibial band because the forces needed to elongate the fascia is too great to produce. The most important treatment strategy for the treatment of iliotibial band syndrome is to have a good rehab program to help load the tissues of the lower extremity. The rehab program should really focus on building strength and endurance in the glutes, but can also involve increasing the strength and endurance in the quads as well. A typical rehab progression for building strength and endurance in the glutes would start off with something like a supine bridge or a side-lying hip abduction exercise, both with a mini loop to help increase glute activation. We could then progress the exercise into something a little bit more functional, such as a reverse lunge or a single leg deadlift. Thank you guys for tuning in to another episode of Doc Talk. I hope that you guys found this video useful. If you did, please like this video, and if there's something you'd like us to cover in the future, let us know in the comments below.